Hello guys, welcome to today's video. Today I was assisting senior medical admin in ICU as an ICU manager. I saw a lot of patients suffering there due to various diseases and various ailments. I interacted with a lot of nurses who are working day in day out there taking care of the patients. In pandemic, their workload has increased significantly and we should thank them and all the frontline workers for taking care of us and the society. One of the things that I want to focus on today's topic is why we should take care of ourselves, or the title of the video can be why self-love or self-care is not selfish. One nurse said a very good quote today. She said the only time people are happy coming to the hospital is when a woman gives birth to a child in the hospital. She and all her family members are so happy. Rest all the times somebody or the other is sad due to some disease. When you are a frontline worker or an admin working in a hospital, you see a lot of people suffering due to various diseases. I observed today 3 of the patients were COVID positive, which were kept in a separate wing. 2 others had cardiac problem, 2 had kidney problems. There is a separate dialysis ward in which 18 people were admitted and getting their blood transfusion done. They must have some kind of kidney ailment. The relatives of these people are also very tensed during the course of time they are admitted in the hospital. Some do not make it, unfortunately. Patients who are old have low immunity. During COVID times they are getting superimposed with the COVID infection. So when we are very young, we should take care of our health and our body. We should treat it as a machine, or old timers say we should treat our body as a temple, and we should eat good food. We should drink water in sufficient quantity daily, and we should not eat too much junk. And the relatives of these patients also suffer along with the patient, because particularly the families of lower middle class background have a trouble in paying the deposit to the hospital. They do not earn much, so it is very difficult for them to pay the fees for medical treatment. Very few people have knowledge about medical insurance. People often say that healthcare sector will be the sector of the decade and it is going to contribute to country's GDP, but I don't think so. I think medical insurance will be the sector which may boom. It is a huge task to sell medical insurance. I saw a lot of guys outside the hospital. They had put their marketing tent and selling medical insurances, but I asked one guy that how much sales do you do? He said 2 out of 100 people buy the medical insurance, which also indicates that there is so much less awareness about medical insurance and its importance in the society. And same people, when they come to the hospital, it is a difficult task for them to literally pay the hospital bill for their parents or their friends or their relatives. So people do not take care of their health. People do not take care of their finances. People do not take care of their life as a whole. Mental health to chhod do aap. It is a separate problem which is hidden in India. I think 7 out of 10 people, which may include me also, may need or should go for some or other type of counseling. In the Western civilizations, going to a shrink is not a stigma. But in Indian society, if you even tell your parents that you want to go for some kind of counseling, they old timers are so headstrong that they feel that their child is getting depressed, he or she may do suicide, or what is the need for going to a psychiatrist. There is a phobia associated with this particular branch of medical field, wherein actually counseling can be done for career, counseling can be done for health, mental health, relationship issues, temper issues, financial problems. The counselor has to be very good and ethical in his practice, but I think it's a very, very under explored area in the society. Nurses and doctors try their best to treat these patients and try their best to counsel their relatives, but sometimes I feel very sad that these people do not have the knowledge of what they are exactly doing in life. Just to give you a simple example, when you buy a packet of cigarette, or when you buy a packet of gutka or tambaku that these people consume, there are clear images of oral cancer, lung cancer printed on packets of these things, but yet people consume it. Whenever I am in a good mood going to a hospital, or whenever I feel like counseling someone, I just tell that particular person, if you can afford treatment in a multi specialty hospital without taking udhar money from somebody, then you should consume these products. If you can afford a liver transplant, then you should consume alcohol. If you could afford treatment of lung cancer in Tata Memorial or in any private hospital, you can consume these products. My wife is currently working as a fellow in Tata Memorial Hospital, and I sometimes visit her there just to help her in some completing some formalities, or just if I'm in that area, I do visit her. The amount of people that are waiting on roads to get their treatment done just because they have some or other kind of cancer is horrifying. It is frightening. For oral cancer, since I also have a background of that field, oral cancer is caused by all the degenerative debilitating habits. There are genetic predispositions that contribute to occurrence and exaggeration of these diseases, but common causes are degenerating habits: gutka, tambaku, alcohol consumed by these people, which is due to bad habits. Either their parents have it or their friends have it, they take it up from their hostel circle. It will be very surprising for you guys. I was living in medical hostel, which was combined with engineering hostel when I was in my BDS. The amount of alcohol that is consumed in these hostels, or cigarettes, young boys start smoking from a very young age. I do not know how I escaped these two degenerative habits. I do drink socially, but that is very rare, like once in 6 months, or 2 to 3 times in a year. That also when I'm very happy, not when I'm sad or depressed. So today's video was about why we should take care of ourselves and be selfish. You take care of money and health have a very simple rule in life. You take care of me today and I will take care of you tomorrow. So let us take a oath that we will not be burdened on our future generation to take care of ourselves when we are old. We have to be very fit physically and mentally after we cross 45 or 50 years of age. For that, we have to control our diet from today. I hope you enjoyed this video, and if you have gained 10 to 20% from this video, do like, subscribe and share my channel. Take care. Bye.